Hey everyone, Dr. Dale here. I want to talk about the subject of spinal fusions. Fusion is simply when a surgeon goes in and implants rods and screws or uses like bone chips to immobilize the spine, stop movement in that joint. I'm talking about this because I have a lot of patients ask me about this subject because they're wanting to typically help their friends or their family members not have to have this surgery. And they're afraid for them because going under the knife is a serious procedure. So I want to read to you from the Journal of Spine, February of 2011. This is not a chiropractic journal. This is a surgery journal or a spine journal, a medical journal. It states that in workers' compensation patients, the conclusions of this study showed that lumbar fusion for the diagnosis of disc degeneration, disc herniations, and radiculopathy, which means pain radiating down into your legs or somewhere else in your body, radiating from the low back to somewhere else. In workers' compensation settings is associated with a significant increase in disability, opioid use, prolonged work loss, and poor return to work status. And this is comparing those individuals going through the surgery and those who have the exact same conditions choosing not to go through the surgery. So if you had the surgery, you're more likely to need more drugs and be more disabled. Why is that? You know, I'm a big advocate for common sense when it comes to healthcare, and I really don't understand why surgeons think that by fusing, immobilizing the spine, will work to reduce pain and correct those conditions. So let's take common sense, let's take science to think about this. We're going to talk a little bit about neurology for a second here. We're going to use two terms called proprioception and nociception. Nociception can be used to explain the perception of pain. It's the nerve firing that tells our brain that we're in pain or something adverse is going on. And proprioception is stimulation through movement to the brain. Well, neurology states that as proprioception goes up, nociception goes down. And vice versa, as proprioception goes down, movement goes down or lessens, nociception or pain will increase. So when I think about this, and you should too, before you undergo a surgery, a fusion especially, to have the spine immobilized, does it make sense that once you immobilize the spine, proprioception is going to be non-existent in that area of the spine? Nociception is going to go through the roof. So no wonder these people are in more pain. You know, and innately we know this, because if you were to twist your ankle or stub your toe, a lot of times people jump around a lot, they move more, and then they'll grab their foot or the ankle and they'll rub it and move it, massage it a little bit. Why do they do that? Because they're stimulating movement in proprioception, and through that they're going to decrease the amount of pain that they feel. So again, I want you to use common sense when it comes to this, and then you be the judge.